my channel. Today we are going to do the SBAs regarding endocrinology, and this video is a continuation of a series of goal 5000 SBAs before July 2023. So let's start with our question number one. Question number one is, which of the following disorder is correctly matched to an appropriate diagnostic test? So let's see a little explanation over here. uh, like what happened in the Addisons. Okay, if we say so that there are the three most important diseases, or in the according to the options given over here, there is Addison's disease, there is Cushing, and there is Conn's disease. Okay, now what happened? Let's compare them. What happened? That in the Addison's disease, what happened that the most common cause is basically the chronic primary adrenal insufficiency. Okay, and the hormone abnormality here is that there is cortisol or aldosterone deficiency. Okay, and the most important clinical features includes the hypotension, such that there is decreased BP, hypotension, and there is hyponatremia, and there is hyperkalemia. And the most important test used for this is 9 a.m. cortisol, cortisol, and syn acetylene test. Okay, now let me change color over here. Let's see Cushing. What happened in the Cushing? Cushing, there is increase in the cortisol levels, and the clinical features over here is that as the cortisol levels are increased, thence there will be hypertension. There will be hypertension, and Cushing syndrome is also related with the diabetes and the weight gain. Okay, and the test used for the Cushing syndrome is the most important over here is dexamethasone suppression test, or 24-hour urinary cortisol. Okay, now let's again change the color and let's discuss the Conn's disease. What happens in the Conn's? That in the Cushing there is the excess in the cortisol. In the Addison's there is decrease in the aldosterones, but in the Conn's what happens that the aldosterones, it increases, and as it increases it will be, the symptoms will be opposite to the Addison's, that the BP will also increase and there will be hypokalemia. And test over here we used is the renin aldosterone ratio. We can also use the saline suppression or the fluorocortisol suppression test, but the most important again is the renin and aldosterone ratio. So let's move to our options. Option number A is that the Addison's fluorocortisone test is used. No, we have discussed that in the Addison's there is the 9 a.m. cortisol syn and thyroxine test is used. Okay, then Addison's with the dexamethasone, no, we know that it is done with the 9 a.m. cortisol and syn test. Then option C is Cushing with the syn test. No, that is again wrong, because in the Cushing we use dexamethasone suppression test 24-hour urinary cortisol. Now next, the cones and saline suppression test. No, that's again wrong, because in the cones we use the renin aldosterone system, thus the saline suppression or the fluorocortisone suppression test. Then option 4, that the cones, okay, sorry, the cones, it is a saline suppression test. Yes, we do, because we have discussed that the saline suppression test is used with the cones. So the option D is correct. Okay, Now, as the tests are important, so let me highlight the test again. That in the Addisons, the 9 a.m. cortisone and the syn ethicin test are used. In the Cons, which is opposite to the Addisons, here a renin-angiotensin ratio is used, salt or saline suppression test is used, and fluorocortisone suppression test is also used. And the cushion, the dexamethasone suppression test, or or 24 hour urinary or cortisol is done. Okay, now question number 2, the which major hormone of the pregnancy is produced by the placenta from the 16 hydroxy dehydroapine and androsterone sulfate, or 16-OH DHES? Yes, the placenta, it produces estriol. What the placenta, the most important hormone from the placenta is the estriol. It is the most important hormone of the pregnancy, and it is produced by the by the placenta, and it is produced from the 16-OH DHES, or the 16 hydroxy dehydroapine and androsterone sulfate. So estriol is the major estrogen of the pregnancy, and the placenta is the primary site of the production, and the pregnenolone is synthesized by the placenta from the cholesterol, and this is converted to dehydroapine androsterone in the fetal adrenal gland. So what was the question? Which major hormone of the pregnancy is produced by the placenta from 16 DHES? So the correct answer is the estriol. So the option B is correct. Now next question, which of the following hormone it stimulate the ductal morphogenesis during the pregnancy? That it is the estrogen and the ductus morphogenesis. It is the estrogen and the growth hormone. Estrogen and the growth hormone, they're responsible for the ductal morphogenesis, and whereas the alveolar morphogenesis, it is under the control of the progesterone, prolactin, and human placental lactogen. And the ductal morphogenesis, it is under control of the estrogen and the growth hormone. Now next question, what percentage of the pregnancies are affected by the hypothyroidism? That is the 2.5 patients here, they are affected by the hypothyroidism, including the subclinical hypothyroidism. Hypothyroidism, it is present in 2.5% of the pregnancies, and interestingly, the thyroid peroxidase antibodies are present in 10% of the women at the 14 weeks of the gestation, and only 1 to 3 per thousand pregnancies, they are complicated by the word hypothyroidism. Now next question, polyovarian syndrome, polycystic ovarian syndromes, or the PCOS is classed at, they are classed as a WHO type 2 ovulation disorders. Why? Because there are the three types of the ovulation disorders according to WHO. There are the three in 1, 2, and 3. What happened that in the WHO type 1, what happened there is the okay, the PCOS, WHO classified the PCOS into three groups: the one, the two, not the PCOS, but the ovarian disorders. Sorry, it is the ovulation disorders, into 1, 2, and 3. What happened in the one? There, in the one, there is the hypogonadotrophin, which leads to the hypoestrogenic, and it occurs in the 15% of the cases. The type 2 is there is the normogonadotrophin, which is the normoestrogenic, and it occurs in the 80% of the cases, and the PCOS is examples of the type 2. And in the type 3, what happens, there is an increased gonadotrophin, and leads to the hypoestrogenic. It occurs in the 5% of the cases. Now next question, that a female 42-year female in the clinic who has mentioned that she has been sweating and has a frequent headaches. On examination, you note her blood pressure is 195 to 105 and pulse rate is 110. You suspect the pheochromocytoma. Which of the following condition is not associated with the high risk of the pheochromocytoma? It is definitely the multiple endocrine neoplasia type 1, as the men